My name is Anastasia Wallace. I'm going to demonstrate how to do a white blood cell differential blood stain and counting the white blood cells, red blood cell morphology, platelets, stuff like that. So basically first I will take my blood sample I have here. I will take a clean pipette. I've got a slide here. Right here. I'm recording myself, so I'm doing the best I can to make sure you can see what I'm doing. So basically, I'm going to put it on the paper. You'll be able to see the slide better that way. Take the little lid off. I just need a tiny drop of blood. I'm going to put a tiny drop of blood on the edge of my slide here. Throw that away. I'm going to go ahead and put that back in there. So now I will take another slide and do the actual blood film. So I've got another slide here. I'm going to put it to the drop of the blood until it runs the length of the other slide, and then turn it up, and so now I've got a good blood smear going on here. The slide is now toast. It's no longer usable. I was just used to do that. So now I'm going to wait for that to dry. I can see I've got a good little feathered edge. So we will wait for that to dry, and I will be back. Alright, I can see I have a nice rainbow feathered edge there. So now I will stain it according to our normal staining procedure. So here's the fixative. 10. Shake off the excess. Okay. Now we will use our red. Also 10 dips. Shake off the excess. And then use our purple. Another 10 dips. Shake off the excess. And now again, we will need to wait for that to dry completely. And then once that is dry, I'll be able to actually do our white blood cell differential. Okay, so my stain has now dried. I will go ahead now and put this on the microscope. We will start. I'm trying to make it where you guys can see. I'm so sorry. We're going to start on 10x to find the monolayer. So I'm going to focus in on 10x. Until I find my nice feathered edge here. Okay, that's that. So now I'll move the slide down to 40x and focus on my monolayer. Oh yeah, I can see some nice purple red blood cells, but not, white blood cells, but not good enough to differentiate. You could also see the reddish pinkish color of the red blood cells. So now we'll move to 100x. Put a drop of immersion oil on the slide, because this one is 100x does do it better with the immersion oil. So now I have put a drop on the monolayer, and I will focus on 100x. And this is still Anna doing this. I'm sorry, I'm recording myself and you can't see it very good. Okay, so I will start. I like to start at the bottom, to do this. So I've got it on the bottom here. We're focused really good. I will begin my count. First we'll talk about the red blood cells. They actually look pretty normal. The size, I would call it normocytic. The shape also looks normal. The color, it does look normal Creasia. It's reddish pink. It looks great. So the red blood cells actually look really normal. So now we'll start counting our white blood cells and also our platelets, kind of at the same time. Come over here and get a pen. I'm so sorry. Okay, so we'll start here at the bottom of the slide and work our way up until we get 10 fields of 10 on the platelets and a total of 100 white blood cells. Okay, so on this particular field, let's count platelets first. I do see a few white blood cells. Platelets, 2, 3, 4, 5, 6, 7. There's 9 platelets on this field. And also for the red blood cells, I'm seeing several neutrophils. I'm seeing 8 neutrophils on this slide. Lymphocytes, let's see, I don't see any lymphocytes that are popping out at me. No eosinophils. I think everything on this slide is a neutrophil. Oh, there's 1 monocyte. So 1 monocyte. So we're only at a total of 9 so far, so we'll move just up just barely on our slide. Okay, here's a new field for platelets. Can you see that I am actually looking okay? Let's see. "12 platelets on this field. As far as white blood cells, ooh, there's a lymphocyte. Let's see, 1, 2, 3. There is 6 neutrophils and 1 basophil on this slide. So we'll move to our next field here. Okay, platelets on this field. This is our 3rd field. I'm seeing, only seeing 4 platelets. Up 5 platelets. There's 5 platelets on this field. And there's not many white blood cells, and they are all neutrophils. There's only 4 of those. Okay, so I'll move on to the 4th field. Up just a tad, right about there. Platelets, I am seeing 1, 2, 3, 4, 7 on the 4th field. There's another monocyte on this one. 2 monocytes on this one. And I'm just kind of doing a tally system over here on my paper until I get to 100 on those. Okay. And I think monocyte's the only abnormal, other than neutrophil on this field. So let's count neutrophils. It's actually going to be 7 of those also. So the 5th field, platelets, I'm getting, there's a lot on this one. 12 platelets on this one. And there's an eosinophil on this one. Not seeing any lymphocytes, monocytes, basophils, anything like that. So neutrophils again. We've got a lot of them. There are 6. I'm going to total up to see about where I'm at. 8, that's 10, 18, 25, 31, 2, 3, 4, 5, 6, 7. I'm only at 37 out of 100 white blood cells for the differential on the white blood cells. I've already described the red blood cell morphonology, and I've written that down. Size normocytic, shape normal, color normochromia. So platelets on my 6th field. And then I'll have to move over because I'm at the top already. Platelets. There are 8. Okay. Plenty of white blood cells on this one also. 2 monocytes again. I don't see any other white blood cells besides neutrophils, so I will count them now. Okay, I'll do my 7th field for my platelets, and on this one I'm going to have to move over a little bit, and so I'll be going back down the slide this time. Okay, platelets on the 7th field here. I'm seeing about 8 platelets. Let me count that again. 8 platelets. That's my 7th field. Okay, let's look for our white blood cells. We have a lymphocyte there. Actually 2 lymphocytes. 3 lymphocytes. A monocyte. And 9 neutrophils. So our next field, this will be our 8th field. For platelets, I'm counting 9 platelets on that field. That's the 8th field. So for our white blood cells, on our white blood cells, I've got 1 monocyte, I've got a basophil, and I've got 7 neutrophils. So now we'll count our 9th field for platelets. Count our 9th field for platelets, and I have 7 platelets on the 9th field. There's another basophil. Another monocyte. There's 2 lymphocytes. There's only 6 neutrophils on this one. Okay, so this is our last field to count platelets on before we can get our platelet estimation by counting 10 fields of 10. So this is our 10th field. And I've got 9 platelets. So now I will add up these 10 numbers, divide by 10, and that'll give me my platelet estimation. So I got 26, 33, 34, 35, 67, 38, 39, 40, 41. Okay, so that's 29, 38, 45. So we've got 86. And we're going to divide 86 by 10. And we get about 8.6 platelets per field. That's our estimation. Let's see how many more white blood cells I need to count before I'm through. We got 6, 1, 2, 3, 4, 5, 6, 7, 8 monocytes, 6 lymphocytes, 1 eosiophil, 3 basophils. So that's 6, 7, 8, 9, 10, 18 between those. Now neutrophils, we got 10, 18, 25, 31, 38, 37. More white blood cells, so we're going to continue to do that. And I'm just going to kind of keep doing this until I get to 100. Okay. Okay, move to the other way. I'm just kind of running out of room on my monolayer, and I still haven't quite got to 100, so be real careful to count every single thing. Let's see about where I am. Let's see. So right now we have 8 lymphocytes, 2 eosinophils, 8 monocytes, 3 basophils. So that's 8, 16, 17, 18, 19, 20, 21. So then we'll add these up. That's 18, 25, 31, 47, 54, 60. Okay, I need 3 more white blood cells. So my first 3 I see is it. Okay. Okay, so now I'll write these things percentage. The platelets, we know 8.6 is our estimation. We talked about red blood cell morphology. So neutrophils, I've got a total of 79. So that would be 79%. Lymphocytes, I've got a total of 8. That would be 8%. Eosinophils are 2, so that would only be 2%. Monocytes are 8, so that would be 8%. And basophils are 3, so that would be 3%. Let's make sure this equals 100. I'm pretty sure it does. So 79, 89, 92, 100. Okay, that equals 100%. That's how we do our white blood cell differential, red blood cell morphology, and platelet estimation. The microscope, but I am going to do that, so I've taken off my blood stain here. I'm going to put that to the side. We have got some microscope cleansing wipe. I'm going to set this back up so you can kind of see me in here. I'm just going to kind of dry off any of this oil real gently. Drag it across the 100X to dry it off. Turn off the microscope. My lenses here are still good. Put this back where it belongs. And then, of course, you always want to cover your microscope to keep any dust and debris, small things like that out of there. And that is it.